Hello everyone, I'm Dr. Monica. Today's video will be on local drug delivery in periodontal therapy. So let's begin with the topic. What is local drug delivery system? A local drug delivery device, it consists of two components. First one is drug reservoir that stores the medicine. Second component is the limiting element that controls how the medicine it is released slowly at a steady rate. So this device it holds the medicine and it releases it slowly in controlled way at a specific site. So coming to site of action, it has site-specific delivery. It means that the drug is delivered directly to the target site. It has narrow effect range, which means that it works only in that given area. High dose at treated sites and low level elsewhere. This means that there will be high drug concentration at treated site and a very low level at elsewhere. It can also act directly on the biofilm bacteria at the site of infection. So coming to the rationale for local drug delivery agent, they are used as additional treatment along with scaling and root planing procedures. They help in controlling the bacterial growth on the barrier membranes used during periodontal treatment. When they are placed into the periodontal pockets, they decrease the subgingival microflora. Also, they help in reducing the probing pocket depth and improving the clinical signs of inflammation such as redness, swelling, and bleeding. So, the local drug delivery agents which we will be discussing include the chlorhexidine based products, tetracycline based products, doxycycline based products, arrestin, subgingival metronidazole, subgingival moxifloxacin. So coming to chlorhexidine based products, so these are broad spectrum antimicrobial in nature and the mechanism of action includes it disrupts the bacterial cell membrane which causes the cytoplasmic precipitation and further this leads to the bacterial cell death. Subgingival chlorhexidine, it is available in chip form and gel form. So the chip forms includes the periochip and the periocol CG. So talking about periochip, this is a small biodegradable chip with a dimension of 4 by 5 by 0.35 mm. It is made up of hydrolyzed gelatin matrix which contains about 2.5 milligram of chlorhexidine gluconate. When it is placed inside the periodontal pocket, it releases chlorhexidine greater than 100 microgram per liter for a period of 7 days. So this chip, it can be stored at a temperature of 20 degrees to 25 degrees Celsius. And since it is biodegradable after 7 to 10 days, there is no need for its removal. So after its placement, we have to avoid crossing for around 10 days. So next we have is Periocol CG. So it is a 10 milligram chip with a dimension of 4 by 5 by 0.25 to 0.32 mm. So this is a collagen based biodegradable chip which contains 2.5 milligram of chlorhexidine gluconate. So when it is inserted inside periodontal pocket, for the first 24 hours, there is about 40% to 45% release, followed by sustained linear release for 7 to 8 days. So coming to its resorption, initially there is coronal edge degradation within the first 10 days, then there is complete resorption in 30 days. So this chip, it has a shelf life of about 2 years. So the gel form of subgingival chlorhexidine, it is chloride. So chloride, it is a xanthine based gel which contains 1.5% chlorhexidine. It is available in pre-filled syringes with blunt needle, making it easier to directly apply inside the periodontal pocket. So this gel, it has dual action formula, that is, it contains 0.5% chlorhexidine in slow release form known as digluconate and 1% chlorhexidine in rapid release form known as dihydrochloride. So when it is placed inside the pocket, it is not easily washed away by either saliva or GCF and it can maintain effective chlorhexidine concentration for about 6 to 15 days, and then it gets resorbed in about 10 to 30 days. So coming to the tetracycline based products, we have tetracycline containing fibers, periocol, TC vial, and periodontal plus AB. So coming to the tetracycline containing fibers, these are ethylene or vinyl acetate copolymer fiber of 0.5 mm diameter. They were the first local drug delivery system introduced in the US, and they contain about 12.7 milligram tetracycline. When they are placed inside the periodontal pocket, there is sustained drug release greater than 1300 microgram per liter for approximately 10 days, which exceeds the inhibitory level for periodontal pathogens. Main clinical benefits include that it decreases the probing pocket depth and also decreases the bleeding on probing. So next is Periocol TC vial. It contains 25 milligram fish type 1 collagen and 2 milligram tetracycline hydrochloride. It is biodegradable and it releases the drug for about 8 to 10 days. It is placed inside the periodontal pocket after moistening with saline. So whenever it is placed, periodontal dressing, it is recommended to prevent its dislodgement, and it is sterilized by gamma radiation, and it has a shelf life of about 2 years. It is used as an adjunct to SRP for pockets greater than 5 mm, and it can be repeated after every 3 months. So next is Periodontal plus AB. It is a bioresorbable tetracycline fiber. It consists of 25 milligram fibrillar collagen along with 2 milligram tetracycline hydrochloride, and it is supplied as strip with 4 individually sterile packs, and it is biodegradable within the 7 days inside the periodontal pocket placement, and it is retained using periodontal dressing or using a dental adhesive for about 10 days. So coming to doxycycline based products, we have Atridox and Legosin. So next is Atridox. It is a subgingival controlled release gel available in 2 syringe system. So after mixing the final preparation, it contains 10% doxycycline hyclate, that is 50 milligram of doxycycline and 500 milligram gel, which can be directly injected inside the periodontal pocket. So Etridox, it is broad spectrum and bacteriostatic, that it acts by inhibiting the bacterial protein synthesis at ribosomal level. So there is doxycycline release for about 7 days in the GCF, and this Etridox, it is biodegradable. So it is mainly indicated as an adjunct treatment for chronic adult periodontitis, and its use has proved to decrease the um, probing depth and decrease bleeding on probing, and also to improve the clinical attachment gain. So next is Legosin. It is a 14% resorbable doxycycline gel available in single-use cartridge. So whenever this gel it gets discharged inside the periodontal pocket, we can see that there is a drug release and there's peak GCF level within the first 5 hours, which is maintained greater than 16 microgram per milliliter for at least 12 days. So in the treated area, we have to avoid mechanical oral hygiene for about 7 days. So next is Eristin. So this is a subgingival minocycline. So it shows a sustained release of minocycline microspheres when used as an adjunct to scaling and root planing. Each unit dose cartridge, it delivers around 1 milligram minocycline, and Eristin, it is broad spectrum bacteriostatic, that is it inhibits the protein synthesis. Also it is biodegradable, and we don't need any dressing or adhesive. For the first week, sticky food must be avoided, and for the 10 days there should be no interproximal cleaning. So the main clinical benefits of using Eristin includes It reduces probing pocket depth and it can be used as maintenance therapy in adult periodontitis. And also, with its use, there is no opportunistic overgrowth of bacteria. So coming to subgingival metronidazole 25% gel, it is applied to periodontal pocket where it melts with the body heat, hardens or crystallizes on contact with water. It contains metronidazole benzoate, which is converted to active metronidazole by GCF esterases. It is an oil-based dental gel, and there is two applications needed 1 week apart. So coming to subgingival moxifloxacin, so it is a fourth generation fluoroquinolone. It is a broad spectrum activity, that is, it is effective against aerobic and anaerobic bacteria. And it inhibits the bacterial replication by targeting the DNA gyrase and topoisomerase 4. So the adverse effects and cautions required during its use. So whenever there is hypersensitivity, we must avoid it in patients who are allergic to any ingredient. There can also be microbial overgrowth, and caution is advised during pregnancy. And the use of tetracycline, it leads to discoloration, and in severe periodontal defects such as in acute abscesses and where there is minimum remaining periodontium, we must avoid its use. And there are also oral hygiene restrictions during its use, that is, we must avoid brushing or interdental cleaning for about 7 to 10 days post application. So if you have liked the content, please like, share and do subscribe to this channel. Thank you.